Joins us every Wednesday. Get a little health segment. Good morning, Dr. Bradley Freeman.
Hey, good morning, McGraw. Good morning, Kelly.
Let's talk. Let's talk a little cancer here.
All right.
What is? You passed me a note. What is the new lung cancer?
Well, what is new in lung cancer? And I think this was a request from one of your listeners to update what is current about lung cancer. And I think a couple of things have been in the news recently. One is very practical, and it deals with how do you screen patients at risk for lung cancer. And the whole concept of screening is that you target these tests to at-risk individuals. Ideally, the tests should have a very favorable signal-to-noise ratio, meaning it should be very effective at discriminating people that have the disease and those that do not. And so there's been an enormous amount of effort in the last 2 or 3 decades as to how best to find lung cancers in a treatable stage. And that started out with such things as chest x-rays, and more recently moved to other fancy x-rays, notably CT scans. And suffice it to say, synthesizing a lot of research in this area, experts in this area have made the following recommendations, and that is that individuals who are continuing to smoke or have a significant smoking history and have not quit smoking in the last 15 years should, on a yearly basis, undergo what is called a low-dose radiation CT scan. And the reason that is a special CT scan is one of the things we found is that all these x-rays potentially expose people to radiation, which in and of itself can have a harmful effect. So those are the current guidelines for people who have a heavy exposure to tobacco use. And I would also say, as an aside, the most important thing to do with respect to diminishing your risk of lung cancer is obviously to stop smoking. So that most lung cancers are overwhelmingly associated with smoking. So stopping smoking is the most important thing. But for individuals who are at risk, they should be undergoing these annual low-dose radiation CT scans.
All right. So I'm 47. I quit smoking 10 years ago. Should I be getting these tests on a yearly basis?
You should not. And the guidelines are for people 55 to 74, and you would say, how did you come up with those cut points? And that is based on, again, an enormous amount of data and literature and research. And it has to do with the fact that when I said that you want a test that has high signal to noise, when you find an abnormality on these CT scans, patients have to undergo additional diagnostic testing, whether looking through the airways in a procedure called a bronchoscopy, or inserting a needle through the substance of the lung to actually sample the spot you see in the lung, or in some cases actually subjecting individuals to surgery. And obviously all those things have risks, and it might be that you would say undergo those various additional procedures for something that turned out not to be cancer. So if you were 47, you would not fall into the screening criteria.
Gotcha. All right. What is it? Just those CAT scans and those CT scans? What about like blood tests? Can that test for lung cancer?
Well, that's another thing that has come up recently. And you were talking earlier with an individual who was talking about the innovation conference taking place in Missouri. And I think one of the things that Missouri is known for also is their contribution to genetics and understanding the genetic code. There's been a tremendous investment both by universities as well as commercial enterprises such as Monsanto to understand how to use this effectively. And one potential utility of that is that you could detect tumorous cells by, if you will, their DNA or genetic fingerprint in the blood. And ideally, a very minute quantity of these cells could be circulating that you could detect. And so there's been an enormous amount of interest to develop these tests, and they've looked at it in, say, lung cancer and other types of cancer, such as prostate cancer and breast cancer. And this holds an enormous promise. I would say at present it's not quite to the point where it would be applied in a clinical setting, but given the rapidity with which this technology is evolving, I think that would happen very quickly. So I think that's definitely on the horizon as another screening tool, which, if anything, might be more sensitive than what we're using currently.
My father died 6 years ago of lung cancer, diagnosed with lung cancer, had one round of chemo, and then he was dead in a week. Once you're diagnosed with lung cancer, doctor, there's clearly some worse than others, but what's the diagnosis? I mean, can there be a full recovery if you're diagnosed with lung cancer?
Absolutely. So, and that's the whole rationale for screening. So there's a variety of different types of lung cancer. As we talked a minute ago, the vast majority are associated with tobacco exposure. And so the prospect for a cure depends upon both the type of the lung cancer as well as the stage when it's detected. So is it detected in a stage, say, where surgery can remove all the cancerous cells, or is it detected after the cancer has spread or metastasized beyond the lung? And so those are the kind of considerations that go into prognosticating someone's prospect for recovery. But nonetheless, I think the two take-home messages: number one, if you're a smoker, stop smoking. And number two, if you fall into these criteria for screening, that's something you should undergo.
57 to 47 years old, smoking history equivalent to 1 pack a day. Currently smoke or have quit in the last 15 years. So those are
55 to 74 years of age.
Yeah,
55 to 74 years of age, and the other criteria that you cited. So this has come out within the last several months, and it is being followed pretty fastidiously by pulmonologists and cancer doctors.
Dr. Bradley Freeman, great job as always. Have a good week, and we'll talk to you next week.
Have a great day.
Dr. Bradley Freeman, really interesting stuff. Dr. Bradley Freeman, professor of surgery at Washington University, in for Dr. Jeffrey Lowell, who is in Djibouti in Africa, doing his duty. So two great doctors who we have access to every Wednesday here on the Big 550 KT.